Good morning. This is Demi Radeva, and I'm a guest host for Hit Like a Girl. And today with me, I have Anna Coates. Thank you so much for joining us.
Thank you for inviting me. It's really exciting to have this conversation.
Tell me about your journey in your career.
Currently, I'm the Senior Gender Technical Lead at the World Health Organization. I've been in the UN system now for 18 years, I think it is. But I've been in the WHO for the last 10 years, 11 years maybe. Previously, I've been in UN Women, and I've been in the UN regional commissions as well, always working on certain aspects of gender equality. I came from an academic background, so I studied gender specifically and areas of actually gender in relation to indigenous women's health in Mexico. I have a long time actually working in Latin America in particular, though I've worked in other areas, but in Latin America. And as you can probably tell from my accent, I am British. I'm Northern British, so that gives me a certain perspective, although I haven't lived there for a very long time.
Amazing. Your role at the WHO gives you a unique global view, and I love that you have the experience in South America. Where are we making progress in women's health equity, and where do you think are the biggest gaps still?
For progress, just the very fact that we're having this discussion, and there are many of these discussions happening at the moment, that is, I think, one of the really key highlights of where we are today. I think we often forget where we've come from and the progress we've made. We get frustrated with the moment, and we don't think about the way in which these things are on the agenda in the way that years ago, 10 years ago, they were not on the agenda. And there are now some really important global commitments, particularly to sexual and reproductive health, to maternal health, to gender-based violence. We have the Sustainable Development Goals, and both the goals on gender equality and the goals on health, they all include these commitments. WHO has its own resolutions and strategies, which countries have signed up to. Countries have their own strategies, their own plans. And there are goals, there are indicators. We're not just talking about this, it's actually, we know where we want to get to. There has been a lot of progress. If we look at satisfaction of women's needs for modern contraceptives, they've increased from 68% to 78% from 1990 to 2022. That said, there is a long way to go from making plans and commitments to real change. Changing the lives of women around the world, that 78%, it is not universal access. There are still 164 million women around the world who cannot decide when they're going to get pregnant, if they're going to get pregnant, how much time to leave between their pregnancies. And this is really an essential part of gender equality. It's not just health, it's about controlling our lives, controlling our bodies. We're in a really precarious time right now, a really polarized time.
Right.
So there is a lot of risk of regression on some of these rights. But actually, I wanted to say as well that the biggest gap is not only just about whether we could regress and whether we're actually having real progress on sexual and reproductive health, but it's also about the gaps in what's actually being talked about, what's actually on the agenda. We often talk about women's health just in terms of reproductive health, just about women in terms of their reproductive function, in terms of our baby-making abilities.
Right.
And we are still whole bodies, we're still whole people. And there's a lot in terms of women's health that we don't talk about. Sex and gender affects all aspects of health. Women suffer more depression. There is obesity amongst women, adult women is higher. There's a higher mortality due to unsafe water and sanitation. Cancer is one of the leading causes of death amongst women. So we need to be talking about all of these issues. So those are the gaps still to even get onto the agenda, I think.
Thank you for that. I'm curious, how do gender norms shape health and access to care differently across regions, given your global career?
Yeah, that makes me sound very old, I have to say. No, that's fine. I recognize that.
Very worldly, I would say.
Very worldly. I like that interpretation. Yeah, that's good. I think one of the most important things, anything you see anywhere in the world, people, there are countries, everyone's a different place, and people are a different place within those countries. But there are harmful gender norms, there are gender inequalities in power, in decision-making, in access to resources in every country in the world. No country has achieved gender equality.
Wow.
The ways in which women experience that inequality, the ways in which gender norms play out or express themselves, of course, that's different in different countries, in different parts of the world. It's also different for different women within those countries. If you're an indigenous woman in Latin America who struggles with poverty, with discrimination, with access to quality, culturally appropriate services, your experience is not the same as mine. Right. If you are, like me, an urban European woman, we also have an overburden of caring responsibilities. That affects our mental health, affects our ability to access quality care services. If you're a trans woman who's experiencing stigma and discrimination in accessing care, if your legal documents don't match your gender identity, even for men, we also have to have a focus on men in this discussion. There are men in societies, most societies in fact, where masculine norms mean you need to kind of like demonstrate strength and that accessing health services or even thinking about susceptibility to disease is a sign of weakness. So all the experiences are different. And it's not just, I think, country to country, it's person to person, but they're all underpinned by these harmful gender norms and inequalities, whether or not they intersect with other forms of discrimination as well.
So how do we go beyond that? Let's talk about underrepresentation in research or understudying some of these aspects in research. Why is it important to make some changes?
Well, it's incredibly important for two really good reasons. Good science and gender equality. Of course, I'm going to say that, but I'm a gender advocate. But first of all, let's go back to the science. I mean, not all bodies are the same. Sex characteristics influence disease risks. They influence progression, outcomes. If we ignore these, we're really ignoring key variables, and we are stalling scientific rigor, we're stalling excellence, we're not gaining complete scientific knowledge. And it's not just about sex characteristics, all those gender norms that I just mentioned, those roles, those inequalities, they affect exposure to health risks. They affect the feasibility of interventions. How do women's roles as carers affect their risk of mental health problems? If a woman doesn't have the autonomy to travel independently, she doesn't have access to resources, how feasible is an intervention that requires regular monitoring, for example? If we don't know this, we are not going to be as effective as we need to be in terms of the knowledge and in terms of the interventions. And of course, gender equality. If we don't know about the specifics of how women experience health differently or disproportionately, we can't address them. And then it's impossible to equitably meet their needs and rights. And we can't really meaningfully say that we're trying to achieve universal health coverage if we're not meeting the needs of 50% of the population. And that's really the essence of gender inequality. It's considering female bodies as secondary to male bodies, women's experiences are secondary to men's experiences and lives. Health's a right, and it also enables other rights. Women can only achieve their full and equal rights, opportunities, capacities to participate in society with health and well-being across the life course. And for that, they really need to be visible, not invisible or secondary. We need the complete evidence and understanding on the dynamics of sex, on gender and health. Only with full and equitable representation in research we're going to achieve that.
I'm curious, what is the World Health Organization doing to make sure that data collection and research evidence consistently and equitably represent women?
Well, as WHO, I think our most important entry point is that we are the science and evidence-based health agency in the UN system. And we really need to, and we do, leverage our role as that evidence-based agency. We set global norms and standards, and we produce technical guidelines for countries to use to help shape their own structures, their own guidelines, their own services in ways that are appropriate to them. I mean, you will know, everybody knows that in the current context, WHO's role and sex and gender is being questioned. There's a huge amount of polarization that's out there. And I think in this context, even more than ever, it's really important that we reaffirm scientific rigor and global commitments to health equity, to gender equality through the standards that WHO sets. We have now adopted the SAGE guidelines, the Sex and Gender Equity in Research guidelines. We don't want any guideline, any policy or any report that comes out of WHO to ignore sex and gender. That would be really setting the norm for everything else that happens in countries, we hope. But we also need to work at the three levels of the organization. WHO is a global, regional, and country level organization. We have presence at each of those levels. We, as well as setting the norms and guidelines, we also provide assistance to the countries to help them align with them. We have 6 regional offices. We have around 150 country offices working with directly with ministries of health. So really, we also try to strengthen national health information systems, other data collection mechanisms as well. We want to really try and address what are the practical barriers in countries. It's no good just talking about this at a global level. What's actually happening in countries? We know that a lot of this data is collected, particularly in the routine information systems and the administrative systems. When you go to a hospital, you fill in a form. Everybody is collecting that data on sex. What is happening is that is not necessarily reported, or analysed or used. Another really important entry point is with national research institutions. We have a network of collaborating centres around the world. And so what we really want to do is that countries set their own research agenda and that they champion sex and gender in those efforts. Another thing that I would like to say, and this is something that has come up more and more recently, is that I think we need to make things simpler. There is a lot of confusion and conflation out there right now between sex, between gender identity.
Can you unpack that for us?
We had a short podcast, right? Yeah. I think what it is, it's like sex, really, we should be referring to when we're talking about the biological sex characteristics of a person. Now, normally that, for most people, is they are primarily or entirely male or female characteristics. There are some people who are born with both characteristics or unclear characteristics or are intersex, but we've generally categorized people on a binary. And then we have associated certain aspects of the way in which we are perceived by people, the roles that we should play in life, how we live our lives according to that sex. But it is assumed, it's constructed, it's not real in the sense that it shifts by culture from society to society, it shifts over time. So you can see that those understandings of the way people should behave, the way they should relate to each other, what opportunities they should have in life it's not directly associated with their sex. So I think when we're talking about measuring gender, we have to talk about measuring a series of gender-related variables. Yeah. So it could be what power do people have to access decision-making? What power do they have to access economic resources? And it's always relative. So you're relating it because gender is relational, you're always relating it to the other sex. In terms of gender identity, it has very much now become very confused with gender. But WHO recognizes in the International Classification of Diseases 11, we recognize that gender incongruence. So we recognize this state of believing that your own identity does not match feeling, experiences. Someone's own self-determined gender identity may not match the sex that was assigned at birth. Yeah. So it's very important that we maintain these distinctions. There's a lot of data that's collected that not much on gender identity, but a lot which conflates the use of the term sex and gender. And then that gender is then taken to be understood as gender identity. Mm-hmm. So we really need to unpack that and make sure that the data is very clear about what it's collecting data on, when it needs to collect certain data on sex, on gender-related determinants and factors, and where it is feasible and relevant also on gender identity.
On that note, I'm curious, can you share some partnerships or strategies that give you hope right now in the push toward gender-equitable health system creation?
Well, I think bridging the gender evidence gap in global health, it's not going to be a short fix, first of all. It's a collective effort, and it's a long-term collective effort. It really requires all actors in the multilateral system like WHO, in private sector, in the research ecosystem, to all of them look at the ways in which evidence is collected and how the policy pathways that is driving evidence and is using evidence. We are seeing that happen. So there are some really good signs. I mentioned the SAGE guidelines earlier. Many journals now, many international journals have taken up the SAGE guidelines. So any research that comes through those journals should be consistent, should be aligned with the SAGE guidelines. Funders, private sector, other multilaterals are really paying attention right now. They're putting this on the map. You probably have heard about the World Economic Forum's work on policy recommendations to protect and promote women's health. That was a collaboration between the Global Alliance for Women's Health and more than 45 organizations from industry, regulators and beyond. There's also the Innovation Equity Forum, which was convened by Bill and Melinda Gates Foundation. 250 stakeholders from around the world involved in identifying opportunities and priorities for innovation around women's health. There are global platforms like W Health, which is driving efforts with really diverse membership to change healthcare with women at the center. There's 350 organizations across 32 countries, and we as WHO were really pleased to be part of these efforts. And it really does show the power of partnerships, particularly between multilateral agencies, the private sector, civil society in particular, to put things on the agenda. And just to say, data and evidence is a really big part of having a gender-responsive health system. There is a lot more to do. It's not the only answer. Inclusive governance is also really important, but there's a lot of complexity and interlinkages between different parts of the health system that we need to get right. But if we don't have data, we don't even have the starting point. So it is really the building block of all the other changes that we want to see.
Data. I keep hearing that. I'm curious, what message would you give to a young woman entering the global health field today who wants to drive change?
First of all, I would say don't be afraid to speak up. I hope that we are in a different place than when I entered this field of 20 or more years ago. Because sometimes it can be really hard when you're in an environment when everybody else is talking about something else. You really need to be brave to say things the way that you see them, to expose the inequalities that have got no place in today's world. Don't succumb to imposter syndrome. Be confident that your perspective, that your expertise is valid. Don't be diminished. I think the key point, especially for young women, is that you're more about the future and what's relevant and right for today than most of the people you're probably going to be in the room with. People like me. I've been around probably far too long. There are many different perspectives that are expert in their own way, and young women should be really confident in their own voice.
On that note, that's the perfect ending. Thank you so much for spending this time with us and our audience, and thanks for just continuing to advance women's health. Really appreciate it.
Thank you. Thank you for this opportunity.
Thanks for listening. You can learn more about us or this guest by going to our website or visiting us on any of the socials with the handle HitLikeAGirlPod. Thanks again. See you soon. Again, thank you so much for listening to the Hit Like a Girl podcast. I am truly grateful for you, and I'm wondering if you could do me a quick favor. Would you be willing to follow or subscribe to this podcast, or maybe leave us a rating or review? Or if you're feeling extra generous, would you share this episode on your Instagram stories or with a friend? All those things help us podcasters out so much. I'm the show's host, Joy Rios, and I'll see you next time.